A year on since the Aged Care Royal Commission, families with loved ones in a Melbourne nursing home have spoken out about the lack of changes. Their complaints about the Bupa facility at Templestowe include allegations of inedible food and residents left for days without sanitary care. Gerard Hayes is the president of the Health Services Union and he joins us now from Sydney. Gerard Hayes, welcome. What do you make of these latest concerns about the aged care sector?
Good morning, Joe. Look, this is just ongoing and it's getting worse. We've seen the Aged Care Royal Commission several years ago come up with findings that, based on submissions from unions, from the community, from everybody who's in and around aged care. And over the past 2 years, we've seen those concerns being exemplified throughout the pandemic. And now we're seeing no result. And in fact, I think aged care is now worse off than I've ever seen in my 30 years involvement with it.
So what has changed since the Royal Commission?
People are leaving aged care. The workforce has been losing people consistently. The attraction and retention is absolutely not there. People are looking to other areas of employment. Other employers are seeking people who are working in aged care to work from. And obviously at the back end of the pandemic and the borders closed, there's a lot of retail, hospitality, a range of other people who are screaming out for staff. And when there's very little attraction, retention, very little wages in aged care, the people who are giving of themselves so much now are just burnt out. And so we're seeing people leaving the industry.
So what are some of the keys to turning this around?
Well, the first key is that the HSU started a case in the Fair Work Commission, a work value case, which was also a recommendation of the Royal Commission. We would like to see that the government respond to Ian Ross, the Fair Work president, to see that if whatever the outcome is to that case, that the government will underpin it. I don't know that there's been a response to that. I'd like also to see that the opposition come forward in relation to the ongoing concerns of that attraction and retention. But when people are on $21, $22 an hour and they're caring for people, and this is not a transactional relationship in these workplaces, the residents are treated like family, like friends, and it takes a huge physical but also emotional toll and psychological toll on the carers that are looking after those people.
So give us some more detail on this case before the Fair Work Commission.
So the union's done extensive research. We've also offered up economic modelling. We've worked with a range of employers who support our position as well, and some employers have made submissions to support the case. So it's basically a 25% claim, and while everyone sort of thinks, I need to hold my breath, it sounds like a lot, it's $5 we're talking about. So people on $21, $22 an hour get up to $28 an hour. I don't think that's outrageous at all. We're also looking at resourcing so we can fill the amount of positions that need to be filled, which we would estimate about 59,000. And it also goes to delivering on an extra 90 minutes care time, direct care time to residents in aged care. So it delivers an attraction and retention approach. It delivers dignity for our ageing Australians. And I think it delivers a good outcome, not only now, but for the issues that we have going forward. So if we don't fix the aged care issue now, we are going to see a lot worse in 10 years' time due to our ageing population.